and welcome to another edition of Community Chest. This is a recurring program that highlights nonprofits and other organizations or people that are community driven to help in our community, to change it, to make it better for all of us, to help those who need help, want help, and I welcome you to the show. I'm Felix Milan, I'm your host, and I'm happy to have with me tonight Kelley Rowe from the North Bend Medical Center. She's the director of the Health Resource Center at the Medical Center there. Hello, Kelley.
Hello.
Thank you very much for being on the show today.
Thank you for having me.
I heard from a friend of yours that you have started this remarkable program there at the North Bend Medical Center about being well, getting healthy, and it's called Healthy NBMC, a wellness plan.
Correct.
Can you tell us a little bit more about that and how that all came to be?
Sure. How it came to be is I am a community partner with the Coos County Tobacco-Related and Other Chronic Diseases grant. That grant was issued to 12 counties in the state of Oregon, and it's through the Coos County Public Health Department. And they invited me to go be part of the traveling team and to go to 5 learning institutes to learn about and work together about making our community a healthier place. It is now called Healthy Communities. The grant is now called Healthy Communities, and I'm still part of that team. And most of the people that I was working with from various not only our county but other counties, we're all talking, the community partners were all talking about writing wellness plans for their work sites.
And why do you feel that that's important for not only a hospital specifically, but for other work sites to be healthy?
Well, number one, for North Bend Medical Center, since we see so much of the population here, at least in the North Bend, Coos Bay area, and throughout the county, I just felt it was important for us to be a leader. Well, we are a leader, but also to walk the walk, not just talk the talk.
Well, that's great. So when you say walk the walk, it starts with you.
Correct.
And the healthy attitudes and lifestyles that people in the, specifically North Bend Medical Center follow, then that will be emulated by others in the population that may have some type of issues with whatever that may be.
Yeah, chronic diseases.
Chronic diseases, yes. Can you talk a little bit more about chronic diseases? And
Well, yes. Part of the grant, the number one common thread through all chronic diseases and how it was funded is through the tobacco section of the tobacco funding through the state. And so tobacco is the number one cause of death, with everything related to cancer, asthma, diabetes, and so it affects all chronic diseases, and so we need to work on that.
It sounds like you've done a lot of research.
Yes.
You pulled everything all together. This is your program, your plan that you devised specifically for North Bend Medical Center. Talk a little bit about the research and what you've learned from all that.
Well, everything that I've learned, besides how our weight affects us. Right now, we've been working on the losing the weight section of this plan. That was the first thing, because it went into effect in January, and January after the holidays, everybody's going, God, I gotta lose weight, myself included. And so that was the starting point. And so we wrote it based on that, and then I divided it up in various up into 4 sections with weight loss, and we had a little bit of information on tobacco cessation, since the tobacco cessation, not necessarily tobacco cessation, but how far away you can smoke from a business. The 10 feet. And so I needed to learn about that and how it's going to affect all of us and our employees, which for me personally is a great thing that it went into effect. Anyways, the weight loss started. was the first component.
And you being the director and right in there in your program, you lost how much weight?
I have lost 30 pounds based on our plan. But I had several doctors who requested to get Weight Watchers on site because we work really hard at North Bend Medical Center. All of us do. And one of the things that, we're so busy taking care of the employees that we needed to take care of ourselves too. And so based on that, several of the doctors requested that I get Weight Watchers on site. That was the one program that was requested. It's not that others haven't been requested, but that was the number one.
I see. Do you know why?
Several of the doctors had gone off site gone to the meetings, and they were losing weight, and it works.
I see.
So I was able to get it, and we offer it to our employees on Tuesdays at noon. And since it's in my department, I do it too. And for me, I have tried all kinds. Working with all the medical information that I have right at my fingertips, I had all the knowledge, but the lack of motivation. But there's something about the Weight Watcher for me personally that has worked. It doesn't work for everybody. And so there are other options throughout the clinic. But that's been, so many people have lost weight.
Do you have any idea of how much total weight may have been lost there since the program started in January?
The first after the first 10 weeks, there was 176 pounds lost by 12 people.
That's fantastic.
So, and then now at the beginning of the spring, rather than walking was a big part of it, but one of the requests was they wanted a Biggest Loser contest because that was on TV.
Yes.
And we had done it a couple of years before. People came up to me and said, "Hey Kelley, can we get it?" Sure, let's do it. And so I provided it. For some people we did a weekly weigh-in. We did it for 12 weeks. And we opened it up not just to our employees, but we invited their spouses to join. It was so much fun. I opted out of that part since I was already doing the Weight Watchers, and I just didn't want to have any conflict. So I just wanted to be the person in charge to weigh the people and encourage them, since the way I've been encouraged. We had a husband and wife team be the Biggest Losers. He lost 25 pounds, she lost 15. We had several other people lose at least 10. There was a lot of healthy weight loss, and I can tell you right now, we're over a month out, and they're all still losing. They're keeping up the momentum, and it's so great to see it.
I can hear the excitement, enthusiasm you have in your voice, and it is great.
It is
and fantastic.
Really great. Well, they're taking control of their health.
So do you think that this program that you started and had tremendous success with can be emulated other places?
Easily.
Okay.
Absolutely easily. It's all based on what you need.
So how can that happen? How would one of our viewers has a business, and this will be a great way for company morale, great project for us to do health-wise and other. How do we go about doing it? What's the first thing somebody would do?
Well, they would take a survey of how many people would like to do it.
Okay.
Okay. Then you have to have somebody to be the designated weigher. We have a scale in the Health Resource Center that anybody can come in and weigh. And so the staff used that. We used that as the weigh-in, and I had a notebook that was highly confidential that nobody had. I locked it up. So that.
Why is that? Why is it confidential?
Weight is very personal. It's a very personal thing. I know personally it's a personal thing. I don't want people to know what my numbers are, because some people are going to go, ooh. And